What's up, everyone? Welcome to Locked In Med. My name is Dumebi Ene. I'm a second-year medical student. I'm currently on my neurology clerkships, and this is Disease of the Day. So to kick start this series, I wanted to pick a condition that was both fascinating as well as a bit terrifying: locked-in syndrome. I know this is kind of ironic, the name of the page being Locked In Med, me being on my neurology clerkships. I felt like it was only fair to start off with a condition known as locked-in syndrome. Locked-in syndrome, also known as LIS, is a rare condition that usually occurs due to damage to the pons, specifically the ventral pons, which is a part of the brain stem. This usually occurs due to stroke affecting the basilar artery. This injury ends up disrupting the motor pathway, which can basically disconnect the central nervous system, particularly the brain, from the rest of the body. So it disrupts that communication. This leads to complete paralysis of voluntary muscles except for eye movement. So a patient is literally locked into their body, unable to speak, unable to move. However, they can blink and have this vertical movement of their eyes. There are several conditions that can lead to LIS. Some listed but not limited to multiple sclerosis, traumatic brain injuries, tumors. Tumors can actually end up compressing the brainstem, the ventral pons, and then even infections. Infections can lead to damage of that part of the brainstem. And this one I found very fascinating was it can actually be physician-induced, called central Pontine Myelinolysis. This is when a physician rapidly overcorrects a patient experiencing hyponatremia, so you can actually induce some, locked-in syndrome. That whilst conditions such as myasthenia gravis or even Guillain-Barré can present with symptoms similar to LIS, they do not typically come as true locked-in syndrome. They might have similarities and they could mimic it, but then the pathophysiology and the mechanism that causes these conditions are completely different. What clinical features do we see in a patient experiencing LIS? As I stated before, you have complete paralysis of all voluntary muscles. So you can see a patient kind of end up quadriplegic, meaning they can't really move their hands, their legs, they're kind of bedbound. They also can have face paralysis, leading to something known as a bulbar palsy. They can be unable to speak. They can have dysphagia, which ends up being difficulty swallowing. However, a patient can still think, they can still feel, they can hear. So all those sensations are still intact, but then they don't have that ability to kind of communicate other than the vertical eye movements or blinking. So how do we diagnose locked-in syndrome? Well, we have a multitude of different imaging modalities. We have CT scans, MRIs, EEGs, electroencephalograms. We also have something called neuropsychological testing. See, these different imaging modalities can help us kind of localize what part of the brain is damaged. They can also help us determine the cognitive and social function of a particular patient experiencing LIS. And they can just help us, communicate with them and kind of see where and what part of the brain is basically active. LIS can actually mimic a coma and other vegetative states. So it's important to differentiate between brain death and someone experiencing the condition locked-in syndrome. How do we treat this condition? Unfortunately, there is no cure, but early intensive rehabilitation and assistive communication, such as devices such as speech synthesizers, we have eye gaze trackers. These different technologies have been able to help us kind of improve the quality of life of someone experiencing this condition. So when someone can come into maybe the ED, emergency department, or inpatient, and we see that they have locked-in syndrome, as a healthcare professional, you want to first make sure that you treat the acute phase of the disease. So you want to make sure that their airway, breathing, circulation is intact. These are kind of the ABCs that we call them of like medicine and even trauma care. The next, you're thinking of long-term therapy. How can this patient, how do we deal with this? How do we manage a patient, experiencing this condition? There's things such as ventilation. So we want to make sure that the patient might be on a mechanical ventilator to make sure that they're breathing. We want to make sure that the patient may have a feeding tube, which can help with their nutrition. And we also want to make sure that we have ample communication with all the different healthcare providers. Anyone from physiotherapists to speech therapists to occupational therapists to neurologists to the surgeons, physical medicine and rehabilitation doctors, and many more. We want to make sure that we have ample communication with all members of the healthcare team, just to make sure that we're providing the best quality care to our patients. Prognosis is generally poor. However, the patients who are resilient and can adapt can end up regaining limited function over time, and they can have an improved quality of life despite this condition. Final takeaway: locked-in syndrome, also known as LIS, is a rare but devastating neurological condition. It ends up leaving a patient fully aware but unable to move or speak, other than that blinking and that vertical eye movement. So in a sense, they're literally locked into their body, completely aware of their surroundings, but unable to communicate verbally. Advances in rehabilitation and assistive technology offer hope, but early recognition is key. Let me know what you guys think of this condition. Don't forget to like, and I'll see you in the next one. Stay locked in.